So as I mentioned, the first video is going to be breathing based. And we're going to look at 3 different ways of working with our breath to start to help the 3-dimensional rib cage get more functionality, get more movement in there. A lot of times we generally breathe into 1 or 2 dimensions and not quite as full into our 3rd dimension. And there are various reasons behind that. When we start to look at how our lower back is related to our ribs, there's a connection between them in that the lower back is largely about our lumbar spine, and that lumbar spine leads up into the thoracic spine. Now, the thoracic spine is also where the ribs connect into. And so restriction in the thoracic can have issues down below in the lumbar. We may find that actually some of our lower back pain comes from restriction in the middle back or even the neck at points, but more commonly that middle area takes a lot of force. So we're going to do these 3 different breaths and see, does that help to create more space in the lower back. The first one we're going to do is taking our hands and just have them on our side, just on the side of the pelvis. That's it. Right? Just like you're a Superman or Superwoman or Super them. And we're going to just breathe in here. And just normal breath, right? We're not going to try to force in with a big breath, because that's imposing an idea of what our breath should be, which is going to actually activate other muscles that may not need to be activated. Right? And so we're just going to breathe however we can. And what we might notice is that actually as we do this a little bit, if some of the muscles are accidentally in a switched off or a tight position, that even just by doing this can help them come back on, and you might find that the breathing does change just a little bit. And what we're trying to do is to help these muscles and these patterns of muscle change and then keep working with them in a regular way so that the old pattern goes away, the new pattern can go into the regular pattern, and then we have a new, cleaner way of being. That's it. This is all we're going to do for the first part. You can let your hands come down. I like in between to just have reset periods where we breathe normally and we see, well, has any of that old pattern shifted and the new pattern can come in and start to like a train getting back on track, right? So for example, I'm noticing right now as I am breathing that my breath has shifted from before I had my hands there. There's a little more ease in the whole the rib cage. I have some restrictions I'm noticing now, and when I get to the 3rd breath part, I think it's going to help them out a lot. And some of this is very refined, so if you don't even notice any differences, that's fine. That takes time to learn how to drop into that more. So you may feel a lot, you may feel nothing. Whatever you feel is just perfect for where you are. The next breath, we're going to put our hands in our armpits a bit. Right? And we don't want to be too tense, right? And we don't want to be too rigid. And just find a way of having them here softly. And again, we're going to breathe. So for you watching, you might notice that as I breathe, I have a different pattern of my breath from before. And you also might feel that in yourself, that with the hands here, there's a slightly different way of breathing. And there's a few things we're doing here. One is we are changing our physical posture to allow our body to be in a different way of breathing. So some of the bones are slightly different, and the muscles are slightly different. So we have a different relation to our breath here. And we're also having a different concentration from a mental side. We have touch in different areas, and we also have a slight awareness that this is different than before. So we're inviting both a physiological and a psychological inquiry into what are we doing and what's our body doing. And those watching, you might notice that as I breathe, my shoulders go a little more side to side here. Whereas before, there was a lot more of a front and back motion. So as I mentioned before, we're going to be redefining the dimensions of our breath. Well, you can let the hands come down, and again, space in between to notice and to allow whatever is shifted to continue on. Our final one, we're going to have the hands just behind the back. For some people, this can be very challenging, especially when they're really short up in the chest. And sometimes when they're really short up in the chest, the other end of the spine, the lower back, is getting that. So this might be very helpful for some of you. And working on having the elbows go up. We don't want to be right in front. And also not holding too tight, finding comfortable and just breathing. Again, watching here, you might notice as I breathe, there's a little bit more of an up and down motion in my breath here. Or maybe you're feeling it in your own breathing. Again, laying the hands down. So maybe you're noticing from the very beginning, before we did any of these breathings to now, that there's a difference in the breathing or maybe in the whole body. While the breathing may not fix all the issues, it's a great start for a few reasons. One is that it has the benefit of working on a wider area. So instead of looking at just a single tree of the back pain, we're going wide to look at the forest. Another reason is a lot of times when we're in physiological pain, we are contracting and we're holding because we're uncomfortable. And that causes other chains of holding and tension going on. And what we can do by breathing in this way as well is start to find more ease by having a calmer breath, a more open breath. And the more open breath is signaling your nervous system that things are actually okay, that we have safety to breathe. And that's going to actually provide more space in the body. And that lets us deal with some of the pain and reorient to it from a slightly different way as well. So there's a few different benefits of why this practice could be helpful for your breathing. The next two exercises we're do are going to be a little more physiological and helping more the biomechanics of working with that lower back. So I'll see you in those. I hope this has been helpful so far.